Did you know that pancreatic cancer claims more elderly lives each year than colon cancer? Despite this grim reality, the vast majority of adults over the age of 60 have never been educated on its early warning signs. This disease is uniquely perilous because its initial symptoms manifest months before it becomes untreatable. As you read this, there is a 75% chance you have already noticed at least one of its 8 warning signs and brushed it off as a harmless part of growing older. People across the country are sitting in their homes right now, assuming they are simply overtired, experiencing a back flare-up, or dealing with a temporary stomach bug. I am Dr. Alex. Over the next few minutes, I am going to share information that most seniors will never hear from their primary care physicians. Here is the uncomfortable truth. Pancreatic cancer does not carry an 11% survival rate because it is incurable. It carries that rate because it is almost always detected too late. Please stay with me through all 8 symptoms, particularly the 5th one. That specific sign is routinely left off medical checklists, yet it belongs at the very top. Before we dive into the symptoms, you must understand why this disease is uniquely hazardous for older adults. Your pancreas is buried deep inside your abdomen, meaning it cannot be felt during a physical exam. Furthermore, routine annual blood panels will not detect this malignancy until it has already metastasized. It masquerades as the standard aches and pains of aging, which is precisely how it defeats so many patients. Here are the 8 warning signs it leaves behind while it can still be successfully treated. Symptom 1. Intermittent dark urine. When many seniors notice their urine turning dark, their immediate reaction is to drink more water. The color temporarily lightens, they assume they were just dehydrated, and they stop worrying. That single assumption can be fatal. In reality, your pancreas sits right next to the bile duct, a tube that transports bilirubin from your liver to your intestines. Bilirubin is the pigment responsible for giving urine its light yellow hue and stool its brown color. When a tumor develops in the head of the pancreas, it compresses this tube and blocks the flow. Because the bilirubin has nowhere to go, it backs up into your bloodstream, forcing your kidneys to frantically filter it out through your urine. This causes your urine to turn a deep amber, brown, or even a tea-like color. Unlike standard dehydration, this discoloration keeps returning. You might flush it out with water one day, but it will return the next because the physical blockage remains. This is often the very first visible sign of the disease, yet most people dismiss it multiple times. If your urine has been fluctuating between dark and light for more than 2 weeks, it is not a hydration issue. It is a medical red flag that requires an appointment this week. Symptom 2. The radiating ache. The second symptom is highly deceptive because your doctor may have already evaluated it and given you an entirely incorrect diagnosis, such as arthritis, a pulled muscle, or acid reflux. While you waste time treating a phantom injury, the tumor continues to grow. Pancreatic pain has a very distinct signature. It begins as a dull, constant ache in the upper abdomen, right below the breastbone or slightly to the left. It then wraps around your sides and settles into your mid-back, feeling like a tight band constricting your torso. This occurs because the pancreas is embedded in a dense network of nerves. As a tumor expands, it presses into these pathways and radiates pain outward. You can differentiate this from standard back pain by looking for 3 specific clues. Post-meal spikes. The pain intensifies roughly 30 to 60 minutes after eating. Postural discomfort. The ache becomes unbearable when lying completely flat, forcing many patients to sleep propped up on pillows or in a recliner. Resistance to treatment. Over-the-counter painkillers, heating pads, and rest offer no lasting relief. If this pattern matches your experience, stop treating it like a back problem. Tell your physician specifically that you have upper abdominal pain radiating to your back that worsens after meals and when lying down. Symptom 3. Early satiety. The third symptom actively deprives your body of nutrition while you sit at the dinner table completely unaware of what it signifies. You might sit down for a meal, take a few bites, and suddenly feel entirely full, assuming your appetite is simply shrinking with age. This is actually caused by a tumor physically pressing against your stomach from behind, drastically reducing its capacity. Because your stomach sits directly in front of the pancreas, a growing mass will compress it, making you feel stuffed on a fraction of the food you used to enjoy. Simultaneously, The tumor disrupts the production of vital digestive enzymes. Without them, food sits undigested in your stomach for far too long, sending continuous signals to your brain that you are not hungry. This leads to rapid, unintentional weight loss. Dropping more than 5% of your body weight over a 2 to 3 month period without trying is a major medical warning sign. If you have lost 10 or 15 pounds unexpectedly, it is not a positive development. It is a critical warning that your body is failing to absorb nutrients. Symptom 4. Jaundice and unexplained itching. Jaundice occurs when bilirubin levels in the blood become so saturated that the pigment leaks into your bodily tissues. This causes the skin and the whites of the eyes to take on a yellowish tint. In individuals with darker skin tones, this coloration is most visible in the eyes and the palms of the hands. However, there is a secondary effect that few people mention: severe, relentless itching across your entire body without a rash. This happens because the bilirubin deposits irritate the nerve endings in your skin, and no amount of lotion or antihistamines will soothe it. The dangerous part is that pancreatic jaundice looks identical to the jaundice caused by gallstones, which are incredibly common in older adults. A doctor might initially suspect gallstones, delaying the deep diagnostic testing required to find a tumor. This is why you must present the complete picture to your doctor. Mention the dark urine, the upper abdominal pain, the early fullness, and the yellowing skin all at once so the symptoms are not evaluated in isolation. Symptom 5. Unexplained blood clots. Please pay close attention to this fifth symptom, as it frequently lands patients in the emergency room with a life-threatening crisis before anyone ever suspects a pancreatic issue. Think carefully. Have you or a loved one recently developed a blood clot without an obvious trigger, like a long flight or recent surgery? Pancreatic tumors release specific proteins into the bloodstream that alter coagulation, making your blood highly prone to clotting in places it shouldn't. This most commonly manifests as a deep vein thrombosis, DVT, in the leg, causing the calf or thigh to swell, feel warm, and ache with a heavy pressure that rest cannot fix. The immediate danger is that a piece of this clot can break off and travel to your lungs, causing a pulmonary embolism. If you experience sudden shortness of breath, sharp chest pain when inhaling, or a racing heartbeat, call 911 immediately. Data shows that an unexplained blood clot is often the very first indicator of pancreatic cancer, appearing up to 6 months before the tumor is officially diagnosed. Symptom 6. Cyclical fevers and chills. The sixth symptom is an internal alarm that your body triggers every few days, which you have likely blamed on a passing virus. If you had a fever last week that disappeared and then returned a few days later, it is not a standard bug. Bugs eventually clear up. This persistent cycle occurs because your immune system is trying to combat systemic inflammation. Your pancreas is irritated, your bile duct is obstructed, and your body is reacting to the chaos. This does not produce a skyrocketing temperature. Instead, you will experience sudden, deep chills that cause you to shiver even in a warm room, followed hours later by a low-grade fever between 99 and 100 degrees Fahrenheit. It is just mild enough to dismiss, but it keeps returning like clockwork. When this cycling pattern is paired with night sweats, waking up drenched in sweat despite a cool room, it demands immediate diagnostic imaging, not just a prescription for antibiotics. Symptom 7. Unresponsive fatigue. While you might be labeling this next sign as basic tiredness, it is actually a state of exhaustion caused by cancer cells stealing your body's fuel. You might sleep for 9 hours and wake up completely drained, assuming you simply tossed and turned. Normal fatigue can be linked to a busy day or poor sleep, and it resolves with rest. Cancer-related fatigue does not care how much you rest. You can sleep all weekend and still feel an overwhelming, heavy exhaustion. Simple everyday movements, like walking to the mailbox or carrying groceries, suddenly feel like climbing a mountain. Because pancreatic cancer cells compete directly with your healthy cells for glucose and nutrients, they intercept your body's energy supply to fuel their own growth. Your organs and muscles are left running on empty every single hour of the day. If you have been experiencing this unresponsive, profound exhaustion for several weeks, it requires a thorough medical evaluation. Symptom 8. Altered stool. The final symptom is one I have observed in almost every advanced stage patient I have ever treated: yet it is rarely discussed because it happens in the bathroom. Your pancreas is responsible for creating the enzymes that break down dietary fats. When a tumor blocks the pancreatic duct, those enzymes never reach your digestive tract, causing the fats you consume to pass through your body completely unaltered. This changes your stool in very distinct ways. Color. It becomes pale, turning a clay-like gray instead of healthy brown. Texture. It takes on a greasy, oily sheen. Buoyancy. It floats in the bowl due to the high fat content. Odor. It produces an exceptionally foul, pungent smell. This structural change is often accompanied by nausea or vomiting after eating rich foods, alongside a heavy discomfort in the upper belly. Pale, greasy, floating stool that lasts for more than 2 weeks means you need to contact your doctor within 24 hours. Taking action. What you decide to do over the next 24 hours can completely alter your long-term prognosis. If you recognized even 2 of the 8 signs discussed today, your next step is critical. Caught in its earliest stages, the survival outcomes for this disease change dramatically. The primary variable is how quickly a person takes action after their body begins signaling for help. Right now, write down every single symptom you recognized. Note exactly when it started, and track how often it occurs. Call your physician and read this list directly to them. Do not downplay your symptoms or use vague phrases like feeling under the weather. Specific symptoms trigger specific diagnostic protocols.
If your provider attempts to dismiss your concerns without ordering tests, advocate for yourself. Ask directly if an abdominal CT scan or ultrasound is warranted. You are not being difficult, you are taking control of your health. If this information provided clarity you haven't received elsewhere, please like this video to help push it to other seniors who need to see it. Subscribe to the channel for weekly, life-changing health insights designed for those over 60, and share this with a loved one today. You might think you are just sending a link, but you could actually be saving a life. There is one critical piece of information we haven't covered yet. There is a specific triad of just 3 of these symptoms that, when occurring simultaneously, serves as a near-definitive confirmation of this disease. There is a single, underutilized test your doctor can order tomorrow to catch this combination before it advances. That protocol is detailed in the video on your screen right now. Please watch it before you do anything else.